Good afternoon, early birds. Great to see you. We'll give it a couple of minutes to allow people to join. I see at least one of our distinguished speakers. I sent you a small message, Helena, in the WhatsApp.
Okay, have a look.
Thank you. Hello, Sharonda, is that how I say your name? Oh, you're on mute.
That's correct. Good morning. How are you?
Good morning. Wonderful to see you. Thanks so much for being with us. Very excited about this session.
Absolutely.
Warm welcome to those joining. We're going to give it a couple of minutes to get everybody safely settled in the Zoom room. I see another, oh, Titus, welcome. And Clara, great. Lovely to see you, our distinguished guests lining up.
You are muted. You are muted.
Oh, thank you. Sorry. Welcome, everybody. I'll start again. A very warm welcome to all of you for this very special session we're putting on 3 years on how governments are being held to account on COVID. We're really excited to put on this session, a bit of a different one from our usual working group, which takes this slot. And this is really this been inspired by our partners and conversations we've had with partners, old and new, and understanding and learning about the different ways in which they are holding their governments to account, challenging their governments, and not allowing the memory of COVID to fade in terms of being better prepared for the future, and really at the heart of the mission that we share at Pandemic Action Network. So we've got 5 brilliant speakers. Just quickly, we've got Helena Legedo-Quigley, who is from the Saw-Sui Hock School of Public Health, as well as the London School of Hygiene and Tropical Medicine, and incoming Chair of Health Systems at Imperial College. We've got Titus Gitonga from Transparency International Kenya, Sharonda Johnson from COVID Survivors for Change. I think we are going to have Kristen, I can't see her just yet. We're hoping to have Kristen Okiza, marked by COVID, and also recent new member to the network, Clara Collingwood, COVID-19 Bereaved Families for Justice in the UK. Absolutely wonderful lineup. And to kick us off, I'm going to ask all of our guests to take about 5 minutes, 3 to 5 minutes, to talk about what you've been doing in your jurisdiction, in your country or region, to hold your government to account on the COVID-19 crisis. And I know you've got very different stories to tell. I will then ask you some questions and encourage colleagues on the call to put questions in the chat, and I will try and moderate the session, integrating your questions, and we'll have a conversation after that. So Helena, you're very welcome. Thank you so much for being here. Over to you to tell us a bit about the work you've been doing. Thanks.
Yes. Thanks a lot, Eloise, for the introduction. So just to mention that, as Eloise mentioned, when the COVID started, I was mainly based in Asia, but I'm originally from Spain, as you can gather from my accent. And I was a bit stranded in Spain when COVID started. And my expertise is actually on pandemic preparedness and health systems resilience. And when I arrived in Spain, I realized that there was not much expertise. So I'm sure as you all started with the pandemic, you all wondered how best you could help from all your different roles. And in my case, it was very much being an academic and having conducted a lot of the research. So when everything started, I conducted research on health systems resilience, and I was doing comparative analysis, Asian countries, what Europe could learn. But then at some point, I did see that my own country, Spain, had not been well prepared. And unfortunately, they were not learning the lessons as the months were going by. And at that point, you realize, what can you do? Because I was conducting the research, but part of me felt that we had to be more active and we had to hold our government to account. So in order to establish thinking of how to go about it, one idea that I had, and I just want to emphasize that all of this is very context specific and very cultural specific. Perhaps what I'm going to explain to you now, I would not advocate it in other settings. So you have to bear in mind or be aware of that. So the first thing I thought was, it's very important, and we know from our work on health systems resilience, that monitoring and evaluating a response is key. And I realized that it was not only the case of Spain, but particularly Spain was making the same mistakes all the time. And just to give you an example, we were 6 months on the pandemic and we still did not have a contact tracing system in place. So one of my key aspects was, okay, the government needs to take stock, needs to learn from all the mistakes that they were making at the beginning, and they were unwilling to do that. So in order to find a solution, what I thought was, I will gather, and remember, I was not living in Spain, so I had been in Spain 18 years. So I did feel like I was in a safer position because I didn't have a job. So I'm not claiming I was very brave. I didn't have a job in Spain, so I couldn't lose it. So that's why I also took the stand. And what I wanted to do was to involve all the key academics in public health, also behavioral sciences, to all get together and write a report or correspondence in this case to claim for the government to conduct this evaluation, first to conduct monitoring of the response, and then to conduct an evaluation of what was happening, because that was already, we were going into the 8-9 months and nothing was happening, no changes were happening. This was an idea, I just had this idea because I wanted to contribute. I managed to get 20 scientists from different fields, very political in Spain, so I had to make sure they were all from different regions, they all had different expertise, gender balance, which was very difficult. Women were much more afraid to embark on an initiative like that. Some of them, they told me, we're fearing losing our jobs if we go ahead. And then at the end, we wrote the comment, the report, and we sent it to the Lancet. That comment was published, and then you never know what's going to happen. And then after this comment was published, it was providing the evidence, suggesting that Spain had one of the highest mortality rates in the world at the time, highest number of deaths, and we needed to evaluate and monitor. So very, very clear recommendations also of what needed to be done. You never know what will happen, but then the next day, I think there was no news that day, or not much was happening. It was front cover of all the newspapers. All the news outlets started with this news, and it was, for the first time, scientists gather and agree on some action that the government needs to take. Surprisingly, all the media, left, right, they all supported the idea, and then there was pressure on the government to do something. Nothing happened, so they discarded us at the beginning. They were like, oh, this group of people, we are busy with the response, they must have a lot of free time, so be prepared to be attacked also when you embark in these type of situations. And then we thought we were not going to give up. So after 2-3 months, no response, we launched another report, we launched another letter, this time in Lancet Public Health, and again, it had the same effect. So now we're famous, now the 20 scientists that they were claiming for the evaluation, they're back, so they're not giving up. And after that, the minister had to meet us. We had a meeting with him, and then we managed to convince him of the need to conduct the evaluation. He told us that he had to convince 18 regional communities because it's Spain health is devolved. He actually took it on him to do that. He managed to get approval, and then they set up the evaluation, and this is currently happening. So lesson learned, it was a positive outcome. It is true that then we found out that within, and there were comments within the government, and also those that were responsible for the response, they were very upset about this letter and the way that things went. And I think they used to call us like traitors. So that's an example of how little engagement there is between evidence and government, at least in my country. And that was a key lesson learned for us. It's like, I think if I take also the negatives from my side or what we could have done better, I think at that time it worked because this is what we wanted. We wanted an evaluation, and I think it's going to be one of the first, most thorough evaluations being conducted worldwide. But the negative point is that it really showed that we could not engage with policymakers and that there's no channels for us to engage in a meaningful way. And I've had discussions with them after that, and I did suggest we need new structures. We need to be able to convey this information, and that you listen to us, and that we don't have to go to the Lancet every time that you're not doing things properly, and that you're not basing it on evidence. So I have other suggestions on how to overcome that, but maybe we can discuss it later. So I'll hand over to you, Eloise. Thank you.
Thank you so much. Brilliant to hear. And I thought that what was really fascinating about what you said it a little bit in jest, but I didn't have a job, so couldn't lose it. But I think that reality about speaking truth to power is such an important part of this. And especially when we're working on pandemic preparedness and prevention, both making sure we push for what we know needs to happen in future, but also holding to account for mistakes and getting that balance right is really crucially important. So thank you for bringing that up. I'm going to move now to Titus Kitonga from Transparency International Kenya. Titus, if you could tell us in 3 to 5 minutes the approach that you've been taking, the floor is yours. Thank you so much for being with us.
Thank you, Lois. And thank you for inviting us to this discussion. So my name is Tedros. I work with Transparency International Kenya, where we work towards the fight to a society free of corruption. And of course, during the COVID period, we had to adjust accordingly to ensure that there is continued work on accountability and transparency. And part of the work that we did during this period, of course, is just keeping an eye on collecting data or information around resources and the response by government on the COVID-19 pandemic. Among this, of course, the research that we are doing or the data that we are collecting is a rapid response on government's response to transparency and accountability measures during the COVID-19 period, both at national and county or the sub-national levels. And during this period, when you're talking about issues of transparency, we're looking at the extent to which government is availing information, not only on the pandemic, which was readily available. I think there was quite a lot of information, both coming from international actors and also at national level on the pandemic once it was announced, but also on resources. So in terms of what actual resources from government of Kenya that were going to address the pandemic, aid resources that were going into the pandemic and how that was being distributed, and also information around human rights, how citizens were being treated during the pandemic in the areas of restrictions that were being undertaken. So there was quite a bit of for our part of work that needed to identify issues of transparency, and that is access to information. Something else that also came about on issues of accountability was on the procurement processes. So tracking how much procurement is being done by government, who are getting the contracts, and this information came towards the end out of agitation, both from civil society and from other actors, in terms of what we identified a lot of irregularities in the way procurement processes were being conducted. We identified that there was a lapse in emergency procurement regulations, and therefore these lapse also made government or government operatives to take advantage of the situation to bring about issues of corruption in the procurement processes of for either COVID-19 PPEs or other medical equipment or everything that was needed in responding to the pandemic. There was also the issue of managing humanitarian aid materials or aid from donors, and how that was being distributed. So keeping an eye on how even private companies were donating to response measures, and how that was being reported or complemented by government institutions. So out of this, we also did platforms to help citizens access this information. So for instance, we did a COVID-19 aid tracker just to track how much resources and aid was going, and later also came to the vaccine issues on vaccine transparency and also accountability around that. So other than that, we also did sort of sensitization to journalists on how they could better follow up and report on accountability issues during the COVID-19 period. And in doing this, then we're able to ensure that the public is kept aware, and some of the issues that were highlighted on COVID-19 accountability, especially on the irregular and illegal procurement processes, was through the media. And also we did quite a bit of parliamentary engagements to seek Parliament's intervention in holding government accountable, seeking questions or answers from the executive on some of the reports that had come in, either from the Auditor General's reports or from the control of budget in terms of utilization of resources for the COVID-19 pandemic. Out of all this work, of course, some of the work that we've been following up on has included court processes or investigations on COVID-19 accountability issues that had been highlighted. We've had to do public petitions and other sort of engagements, advocacy around getting those who had been adversely mentioned in the COVID-19 pandemic corruption scandals to be held accountable, and also having some of these issues forming part of national discourse, even towards the election, so that citizens are able to identify the extent to which the leaders who they bring into power are able to address some of their greatest concerns around dealing with the pandemic and accountability issues that surrounded it. So quite a bit of lessons learned in terms of procurement processes and how these have now been reformed within the procurement and integrated in emergency procurement processes within the legal framework, and enhancing the capacities of use of technology, e-procurement, open contracting as government processes, and in making sure that they're also applicable to processes of emergency procurement. So those are just but a few of the examples I could give in terms of our work then and what is continuing right now. Thank you.
Thank you so much, Titus. And as you talk about those problems with emergency procurement processes, that's been such a problem in countries around the world, low, middle, and high income countries. So it also strikes me that this kind of lessons learned, tactics and strategies, sharing those across borders is potentially really helpful. So thank you so much for sharing that. I'm happy now to go on to Charonda Johnson from COVID Survivors for Change. Thank you so much for being with us today and looking forward to hearing about your work. Over to you.
Thank you for the invitation and for including us in this conversation. As I talk, my story is a little bit unique. Today I do serve as the Strategic Partnership Manager for COVID Survivors for Change. However, my advocacy and the work that I was doing to hold the government accountable began actually before my time with COVID Survivors for Change. So I want to talk a little bit about that, as well as the work that COVID Survivors for Change is doing. What is unique about my story is I did not wake up and decide I wanted to be an advocate or work for a nonprofit. I came into supporting people who've lost loved ones to COVID because I lost my dad to COVID in a very ugly, traumatic way early on in the pandemic. My dad caught COVID leading worship in a church where pastors were encouraging people not to mask during a time when masks were required and vaccines did not exist. So as a result of the trauma and the loss that my family experienced, my biggest concern, number one, was at the time, masks were very politicized. There was a lot of misinformation, disinformation, controversy, even about people who were dying of COVID. I did not want my dad and my family's experience to be swept under a rug or ignored or minimized. So one of the things that I first did after my dad lost, I was kind of ostracized by my community because I was sharing our story that my dad caught COVID in a church. I lost my entire church, really, community. And I connected with the COVID community. My first connection was with a group, COVID-19 Loss and Support for Family and Friends. It's the largest Facebook group, I believe, in North America, or I should say in the United States. And that is a group where people come together and basically share their stories and support each other in grief. One of the things I think people don't really understand, because of how the numbers of deaths in the US were ignored or minimized, people coming together in that manner and sharing their stories and experiences really is critical. And it's one way we hold the government accountable, because you have a group of people who have all had the same experience who are saying, yes, my loved one did die of COVID. So in that group, one of the first things I saw, people were posting these pictures of their loved ones' names with white flags. And I was like, what is this? Where is this place? And I discovered that an artist, Suzanne Furstenberg, had built a memorial in Washington, D.C., where she was planting a white flag for every life lost to COVID. And it's a long, crazy story. I ended up meeting her, connecting with her, and singing at her memorial, which went viral. And in turn, she invited me back when the memorial closed to come back and sing and speak. And then she rebuilt that memorial the following year. I believe it was November of I want to say 2021, where she planted a white flag for every life that had been lost to COVID on the National Mall in Washington, D.C. Now, keep in mind, the National Mall in Washington, D.C. is right in front of the White House. So that was a very strong statement where we were saying, I think at the time it was 700,000 Americans. We wanted the world to know, we wanted our leaders to respond to the fact that this many Americans were dying from COVID. I think it was probably not long after that that I connected with COVID Survivors for Change. COVID Survivors for Change is an organization that supports individuals who have been directly impacted by COVID. In this organization, we share our stories, we support each other, we advocate for a stronger pandemic response. And for us, honestly, for me, that was what drew me to them. It was the advocacy impact or aspect, because at the time, people who were losing loved ones, people who were affected by long COVID really felt a loss of control. We didn't really know what to do. How do we bring this conversation to our government? How do we bring this conversation to mainstream America where they understand that we have needs for support? So one of the things that our organization does, and I think we do very well, is we empower people in advocacy and we give them tools so that they learn how to harness their stories and share them. We support them through mental health, which is critical, because how can you share your story publicly if you're falling apart mentally? And how can you continue to be an advocate if you're falling apart mentally? We have provided more than 4,000 hours of free mental health support, and this is with mental health professionals since the pandemic began. Every week we have support groups. We have Spanish-speaking support groups. We have support groups for people with long COVID, and support groups for people who have lost loved ones to COVID. One of the things that we've done this year that I'm really proud of is we empowered people with a toolkit, basically to have conversations in their community where they could talk about how this experience with COVID impacted them and what should be done in their community as our government says we're moving forward to include them. We also advocate at the federal and the state level. So one of the things we've pushed for, that we're continuing to push for, is college scholarships and baby bonds for the more than 300,000 children in America who have lost caregivers or parents. We actually worked in partnership with another organization in 2021 to actually have a bill passed in California that would provide scholarships. And we're currently working on a bill in New York. Literally within the past month, we had an advocacy day in Albany where a bill was brought to the forefront. And we are working now to get more co-sponsors for that legislation so that a similar bill will happen in New York. That's, in summary, what we've done, what we're continuing to do. And I'm sure there will be more in the future that we will work on to hold our government accountable, but also to support our community. That's really, for us, what centers all of the work we do, is supporting our community.
Thank you so much, Charonda, and thank you for sharing the details around your loss. And I'm so sorry for your loss. And thank you for all the amazing work you channeled that energy in such a way to be helpful. So very inspiring. That sets the scene for our next speaker as well. If I can go to Clara Collingwood from COVID-19 Bereaved Families for Justice in the UK. Clara, it'd be great to hear a bit about the origins of your work and some of the things you've been doing to hold the UK government to account. The floor is yours.
Well, thank you very much for having me, and it's really great to learn from all of you. And it's kind of quite similar to Charonda's work, essentially. I'm the campaign manager of COVID-19 Bereaved Families for Justice, but it's a member-led organisation where every member has lost a loved one to COVID-19. And it came about in the very beginning of the pandemic when our two founding members met on Facebook when they were posting saying it would be, they'd just lost their loved ones in the first wave. And they said, you know, we need to have an inquiry into why. Originally, the question was why we had locked down so much later than the rest of Europe. That spiraled and became a support group on Facebook that was growing hideously as the numbers grew, exponentially in the UK. And then they partnered with some amazing lawyers who kind of their bread and butter is kind of inquiries. So like you may have heard of disasters like the Hillsborough disaster in the UK and things like that, who are absolute experts in holding government to account. And we started campaigning properly for an inquiry. And the government was incredibly reticent to give a date or say yes to an inquiry. They didn't think it was appropriate at any point. Then they kind of moved towards saying that they would have an inquiry once the pandemic was completely over. But that didn't give time to learn lessons that would save lives in this pandemic. So we took out a judicial review against them, or threatened them with a judicial review. And then did an action quite similar to what Sharonda was speaking about, where a wall opposite Parliament was painted with a heart for every single life lost to COVID in the UK. And that was quite a good kind of a starting place for kind of the political action that we were taking. Anyway, the inquiry has now begun, which is good news. And we've been very central to setting up the terms of reference. So we're keen that we'll look at every single aspect of the handling of the pandemic in the UK. So far, the inquiry has said that they will look at all of those issues, but we are quite far from having an inquiry that's fit for purpose, unfortunately. In particular, the issues are around the way that families are involved in the inquiry. We believe in lived experience being a really important place to start when it comes to making policy decisions, particularly when the systems that have been designed from the top down didn't work and failed so many people. It's so important that we're looking now from the bottom up when evaluating them. Unlike other inquiries where normally there would be pen portraits where people who have lost a loved one to COVID, to whatever the issue is, can tell a bit about their story and the circumstances of their loved one's death, we are being held very far at arm's length. And there's been a listening exercise that's set up, but it's been outsourced out to organisations that were in charge of the government's public health messaging during the pandemic. So it's a little bit of a stitch up in that sense, and we're trying to make sure that our families are right in the centre by kind of we want guarantees that they can give evidence in reference to all different issues within the inquiry. We also want guarantees that our lawyers can call witnesses from the government, but also from other kind of other experts as well, and that we can question them directly. Our lawyers can question them directly, because if it's left just to a kind of milieu of lawyers who are likely to work for the government again, we fear that the vast inequalities in particular that have coloured our pandemic in the UK, and also that have arisen, new inequalities that have arisen because of the pandemic, won't be addressed properly. So we had a big win very recently because we were told that structural racism would not be included in the terms of reference of one of the modules of the inquiry in preparedness. After a lot of campaigning, we've just kind of last week managed to get an expert witness on structural racism, and that's something that will now be investigated in terms of preparedness. And they were reluctant to do it in terms of preparedness before, because it would be a case of looking at government structures and the UK system in general and saying, is this something that is inherently structurally racist? But now they will have to. But just very quickly, because I know don't want to go on for too long, but so as well as making sure that families are at the heart and centre of the inquiry, we're also campaigning for change that needs to happen now. So that involves things like making sure that free testing becomes free again, making sure that there's a public ventilation bill in public spaces, and bringing sick pay up to date so that people can afford to stay at home when they're ill. And then beyond that, as the inquiry reveals more things, we will be working with policy experts to make that into policy recommendations that will then force the government to implement. And then the overall kind of end point is that, as I'm sure everyone knows, with inquiries, often a lot of talk happens and then the recommendations aren't made. The recommendations are made, but they're not implemented by the government. So we're really about kind of building the political pressure so that whatever government is in, by the time that these recommendations are coming out, feels the absolute imperative to make what are going to be quite expensive changes in almost every single aspect of societal planning and government legislation almost. Anyway, that's me. Thank you.
Brilliant. Thank you so much, Clara. An amazing work that you're doing with echoes of Charonda's work as well. I'd like to just bring in some follow-up questions. And Clara, if you don't mind, I might just start with where you left off a bit there, thinking ahead to the recommendations of the inquiry. You've created this momentum with this work, and you know that you've got a bit of a stretch ahead for the inquiry to play out. How will you keep the momentum going? Obviously, you've got your dedicated, brilliant partners, members, people, the families that have lost loved ones who are really involved. That must be tricky. What kind of challenges do you have with keeping that energy going in a media environment where sometimes COVID and pandemics more generally slip off the agenda? And I'm sure it's hard for families as well to keep the emotional, you know, it's a lot of energy to focus on these things. So I'd love to hear a bit from you about what you've noticed over the course of the last few years and how you intend to tackle those challenges ahead. And I'll come to other speakers after Clara as well on that.
You're completely right that the kind of media and kind of wider political and societal interest has moved away as people are just very keen to move on and go back to what they consider like a normal life, which obviously bereaved families can't do. What we find quite useful is that our government is riven with scandals from the pandemic period. So, for example, today, Boris Johnson's appearing in a select committee because he lied about a Partygate, which is a scandal where he had a party during lockdown. So that really helps us. So we're doing a lot of work to kind of make sure that our voices and our family members' lived experiences are at the centre of media work around that. And then other than that, it is just a case of having a very, very proactive press office. And we are blessed with a huge amount of, well, I mean, it's terrible that there's so many members, but there's a kind of rotational aspect to it, because people do have different periods of grief and there are different times of year that are harder for different people. We've been kind of investing quite a lot in training a very wide base of media spokespeople.
Brilliant, thank you. That's really good to know, and some really good insights there, and be good to see how this 4-hour session with Boris Johnson goes. Charonda, if I can put the same question to you, given the sort of similarities of the way in which you work, what kind of mechanisms have you put in place to maintain the kind of momentum that you've had over the last few years, and how are you surfing that kind of trickiness of shifting focuses politically and in society more broadly? It'd be great to hear from the US perspective.
You know, I found Clara's response very interesting because I think the environment here in the US is kind of similar, not so much the political politicians getting into trouble with COVID, because nobody really wants to talk about COVID here. It doesn't exist anymore. It's no longer a problem. But in terms of our community, I think that place that we are, knowing that America has decided, let's turn the page, we're ending the public health emergency, COVID is no longer a problem, that alone is a lot for people who've lost loved ones to COVID to process, for people who are living with long COVID symptoms to process. So it's funny, at the end of the year, we really as a team kind of sat down to reassess and reevaluate, where are we? Where do we go from here? How do we, you know, push our community forward in turning this page? And that's actually one of the reasons we created the COVID conversations that we started having at the beginning of the year, because we realize things are changing in America. We have to change our playbook. We have to strategize and think about this differently. So we've really worked to empower people in our community to have these conversations in their community. We kind of took a step back and said, let's talk about this pandemic. How did it evolve? What happened? Let's talk about it from the person who didn't experience it to the person who did. And we've given them a toolkit to actually have those conversations. The other thing I think that we learned throughout this really is that it's important to push forward policies that will benefit our community, even if they're not at the forefront of COVID. For example, one of the things that we advocated very loudly for in this country was extended paid time off for all workers. It failed at the federal government level, but in my own state, in Delaware last year, we were able actually to get a bill passed that provides extended paid time off for all workers. So we look for policies like that that we can jump onto and kind of champion and push forward to help and protect people in our community. Policies like I mentioned, you know, the baby bond scholarships. The other thing that we will always, I believe our organization will always do, because it's one of the core things we do, is supporting our members in healing. So we will continue these support groups, because out of those groups is where healing happens, but it's also where the empowerment to do things come from. Many of these ideas of things that we've worked on have come out of hearing the problems that people in our community are having and striving to work to create solutions for them. And then finally, I think probably one of the biggest things we've done that has continued to fuel us is throughout this entire pandemic, we have partnered with many different organizations in the community who are working on different things. So behind the scenes, many of our members don't know this, we partner with organizations that their primary goal is supporting people with long COVID. We work with organizations that are maybe their wheelhouse is a little bit different than ours, that offer services and are doing things that are cutting edge to advance support for our community.
Thank you so much. Really rich response. Helena, when you think about your own efforts in Spain and indeed other work you're engaged in, how do you work to maintain that momentum, and what's the kind of political, social atmosphere there? And would you say that the setting up of an inquiry has actually helped keep it in the public domain as well? Does it serve a dual function? And tell us a little bit about that dynamic. Thanks.
Yes. So first of all, I wanted to say that I was very inspired by my other speakers. And just to reflect that, unfortunately, in Spain and other countries, we didn't have these groups of families getting together. And in Spain, we didn't have it. They did not organize themselves, unfortunately. So I think my case, it's more like a top-down approach. And it was but already in Spain, there were like the fact that scientists got together, it was a huge highlight, because not even scientists sometimes agree. So my experience in terms of thinking now moving forward, so the inquiry has been launched and it's completely secret and nobody's talking about it. The same as in the UK and the US, nobody wants to talk about COVID. But the reality is that countries are not preparing and not developing preparedness plans. And that's what really worries me now. And the second point is that countries are not preparing the health systems and rebuilding the health systems and the primary health care and supporting the health workers. This is happening globally. And this is where I think, on the one hand, we have a window of opportunity, because this is the time to transform our health systems, but that's going to fade very fast. And countries are not responding to that. So I'm always thinking like of ways of turning that around. And another area, before I give the second solution or second idea that I had, is that also when we're measuring which countries succeeded or not, because we did, I used to work for the independent panel also that was evaluating the response at the global level. And I was responsible for doing an analysis of 28 countries. And it was this idea, which countries did well or not. And reflecting with other colleagues now, is like, now looking back 3 years, it's not only going to be about mortality rates, it's how our societies have been left after COVID. Because a lot of our societies are completely divided. Politicians have been fighting all along, and it's understanding that what has it done to the trust that we have between politicians and the population, and also among us. So within that context, and in my own country, it's like politicians are fighting all the time. It's going down to society. We have the far right, which we never had, that is really high. It's getting a lot of votes. I was trying to think, I don't think I can do a movement again that is blaming the incoming government or the current government. So I was trying to, I thought, I think society, at least Spanish society, needs something a bit more positive. So my next approach is that I've been working with the younger generation of politicians in Spain, and they're all working in health. And I had a meeting with them, and I thought they were all going to hate me because I've been quite vocal in terms of criticizing a bit politicians. So when I went to the meeting with 20 politicians from all the different parties, I was like, okay, prepare yourself. And they were all like kind of secretly saying, Elena, we really, it's amazing the work that you did. We really need evaluations in our country. But our bosses, the next generation, I mean, these were like 20-year-old politicians, like, but they don't let us do that. Anyway, we had an amazing, amazing meeting. Like, it was very inspiring for me. We were all coming up with the strategies, how to evaluate. And then at the end, I said to them, let's write something together. And because this is so amazing, you all agree. And they said, oh no, but they will fire us next day. We need to be shown that we are fighting. It's like, if we want to progress in our political ladder, I need to fight with this one here and with this one here. Anyway, I left a bit sad, but then after a few months back, the person that organized this meeting said, look, Elena, some of them have come forward and they want to do it. They want to challenge a bit the system and write a report on what should be the priorities for reimagining the health system in Spain, how to prepare for a pandemic, and that all the parties, the new generation, they write a statement together for a pact for the country, together with scientists. So this is my new approach now. So I'm trying to get a group of scientists, a group of political leaders from different parties, for all together to join in a statement for what we need to do in terms of pandemic preparedness and how to reimagine the Spanish health system. And when you think of the solutions, they're not so difficult. I mean, we all know what we need to do: strengthen primary health care, support our health workers, have pandemic preparedness plans. So if I manage to succeed, I think that will be even bigger than managing the government to do an evaluation. Everybody is like, if you manage to get the political parties in Spain to agree, this will be like your biggest achievement ever. So I don't lose hope, but I cannot promise I will succeed.
That's fantastic. Thank you, Helena, and inspiring to hear of that cross-party collaboration. And also it reminds me of the climate movement maybe 20, 25, 30 years ago. It started out highly politicized and indeed in some corners probably still is, but has evolved over 30, 40 years to become a mainstream. Everybody agrees that it's kind of above the usual fray. Everybody needs to fight this together. And I think in terms of pandemic preparedness and prevention, that's where we need to get beyond the mask, not mask, the lockdown, not lockdown, all those very pernicious kind of culture war debates that happened. Although we do, by the way, need to be careful of those, because if another pandemic threat was really on the horizon of a similar nature, you know, we wouldn't want our societies to kind of cleave into in that way. But I think that's the aim, isn't it? To get cross-party, cross-societal support. Titus, I wondered if I could bring you in on this idea of keeping up momentum and how that's going in your home country of Kenya in terms of your transparency and accountability pieces, which are obviously really, you know, you're putting yourselves out there, and TI does amazing work like that. And I can imagine that also gets hard as the spotlight moves on as well. So it'd be great to hear a little bit from you about how you're keeping that momentum up.
Yeah, of course. Thank you, Eloise, and good experiences I'm hearing from colleagues, mostly very humanitarian-led. And on our part, I think the keeping on the momentum has been more on how do we take the lessons that we learned from COVID and strengthen accountability mechanisms. I think it exposed a lot of gaps within our accountability systems, health accountability systems, and the vulnerability that everybody, it didn't matter what, whether you're poor or rich, I think everybody was equally or almost effectively affected by COVID. So that brought a realization on the urgency to deal with accountability issues, equality issues, access issues within the health sector. And that sort of focus has also helped us to push advocacy issues around health sector accountability. So among them, of course, is behavior change in terms of trying to show that where there is no equality in the provision and access to health services, then we are all in danger of, in the next pandemic, it does not matter whether you have access to maybe even medical services outside your country, but if you do not have systems that can take care of you at the moment of need closest to you, then it will not matter how much money you have. So that sort of equality that is required for, and of course, at a policy level, we are talking about universal health coverage and how that has an impact on ensuring that there is access to health services for every person. Of course, is also tied to the Sustainable Development Goals and other commitments that we have made globally, regionally, and also nationally around access to health services. So on the policy front, I think is ensuring that all those gaps that are identified within the legislations or policies, we find ways of including them within the legal frameworks. I think most of that has been done gratefully because of the urgency of some of those issues that had been identified. And then lastly is on outreach and awareness, just what we are doing today, creating awareness on what were lessons, getting to learn from other people, and inculcating the culture of just sharing and learning from each other, because it's the only way that we can grow our knowledge around it. Yeah.
Thank you so much, Titus. A few questions coming in the chat. One from Courtney Carson, building on this idea of how do we keep the drumbeat going, the advocacy drumbeat going, survivors, public and government. And a question I wanted to piggyback on that one, if some colleagues have spoken to this a little bit already, but this question of the collective desire to get over COVID or forget it, it seems to be something of a psychological phenomenon as well, mixed with the idea that a lot of leaders don't necessarily want to put the spotlight on how many lives were lost at home, because they won't come out too well when we look at the detail. And so it's a really difficult marrying of issues there. But has anybody thought about looking into or investigating that psychological aspect, actually, of how we talk to anybody about COVID in a way that resonates and doesn't make people just switch off? Is that anything that people have discussed, thought about? Clara?
I think that we haven't looked into that, and it's a really good idea. But, and this is quite an unpleasant thing to say, but there will be more pandemics. So we've been kind of, it's terrible to say fear mongering, but we are now looking to really emphasize that we need to be heard now in order to save people's other family members' lives in the future. And so we're trying to kind of say to the wider public, this is your fight as well, because there will be another pandemic.
Thank you, Clara. Helena?
Yes, so I think from my side, I completely agree with you, Eloise, that it has to be studied. I haven't seen any work done on that, but I think if we all think about it, it has happened even to us individually, where at some point, but definitely for politicians, they want to move on. In my case, Clara, I think that the fear mongering, at least in my context, would not work. And actually, the people that have done that in the Spanish, they really receive backlash now because people really want to move on. So you also have to be prepared to feeling attacked. And in my case, then I was trying to think, because at some point I was also getting a lot of attacks. I was trying to think of this idea of that we need pandemic preparedness. We need, and this I think, and this that people understand. We need to reform our health systems, and we need to defend public health. And I think that the issue has to be for each country also, because the same way that I said to you that unfortunately families did not organize themselves, in Spain we did have 1 million people demonstrating to save our health system, our public health system. I mean, I think 1 million people on the streets to say you're not going to destroy it, you're not going to privatize it, and you have to provide more funding. So it's always finding ways of doing it. And one last point I wanted to highlight is that, because I was very inspired, but I forgot to say that it would be great if we all work together also. Because Sharonda, Clara, Titus, I mean, I'm listening to all you, I mean, because we all come from different backgrounds, it would be great if we can join forces from the bottom to top, and if we can help each other, because I think sometimes we don't work together either, but it would be great.
I'm glad you raised that, Helena, because this is a bit of a prototype for something to talk to some of you about, to try and connect internationally people working on these issues, organizations working on these issues, so that Pandemic Action Network can use your incredible energy to get change at the global levels as well as the national levels, and importantly, put wind in your sails. Sharonda, I saw your hand up, and then I'm going to go through some of the questions in the chat.
So I wanted to tackle the question that was asked. As far as this being studied psychologically, I don't know that that has occurred in the US. I'd be very shocked if it actually did occur or would occur in the future. But I will say this, I am a veteran who served in the military. And one of the things that I've talked about privately with some of the groups we partner with and their leadership is that in combat, military leaders recognize that often in combat, people experience what's called combat fatigue. You know, you get into a combat environment, you start to see the horrors of war, and maybe a month in, you have what's called combat fatigue. And basically, this is like, I know I should run for cover. I know I should put on my body armor. I know I should do things to protect myself. But here's the thing, I realize that I've survived this for a month and I'm okay. I think that's kind of where we are in this pandemic in America and probably in the world. The world has lived through this and they're still here and they're going, it's really not that bad. Let's just turn the page and act like it's over. So I think that's a reality that we probably all need to understand. But one of the things that I think our organization has done well is we help people to understand that this is not a sprint, it's a marathon. I mean, anytime you're trying to get laws changed in your country or trying to impact the way your government operates or does things, it's not a sprint, it's always a marathon. So we have a lot of conversations. We've done this throughout the pandemic where we've talked about what does the legislative process actually look like? How do we get a bill passed? How do bills change? This isn't something that happens overnight, it happens over time. I think that understanding is very critical for anyone who's advocating. And if you really truly understand that, then it will give you that patience or that drive that you need to keep moving forward. So again, one of the things we do is we educate people. We help them understand what does this process look like, and then we empower them with tools like, for example, our COVID conversations where we talk about how do we have this conversation that nobody wants to have in America. And we literally put the words in their hand to have this conversation in a manner that's non-threatening with government officials, with educators, you know, anywhere in their community where they connect, we empower them to have those conversations.
Thank you so much, Sharonda. You've actually started to answer some of the questions in the chat as well. And I'm going to turn to Titus in a second. Just looking at the questions quickly, there's some about how we talk to people and literally, Sharonda, you're talking about giving people the script, the tools that they need. And we've got a question about how we talk to different kinds of people from Justin, scientists, youth, politicians, public health professionals, and how we connect those dots. And then and from Aminata as well about the youth on the continent of Africa, and have many young people been engaged in your work? So Titus, I will turn to you on that question. Then I'm going to come to Autumn's question on rallying moments. Just plant that seed with you for the final word before we go. Titus, over to you.
Yes, thank you. And yeah, maybe I'll start with the last one, that I count myself as one of those young lawyers who are working on accountability issues in the continent, but definitely there are various ways within which we're able to partner with like-minded organizations, community-based organizations, faith-based organizations, women groups, youth groups, and they support our work in various ways. So for instance, we've had a project on, so when we say we're supporting journalists, we have sort of a media tech hub that brings journalists and techies together. And recently we've included creatives as part of those who would help to tell the story, so that when journalists do stories, then the same stories can be told in different ways and reach a wider audience through either satire, cartoon, or infographics. Yeah, so they're different depending on the capacities of those who be engaging them. They're able to support the work that we do. Even during the COVID period, we engaged.
Sorry, please continue, Titus.
Yeah, sorry about that. So we also engaged in a hackathon to develop the platform, the COVID-19 aid tracking system, and where young techies were involved in developing the platform, and therefore play a role in seeing that there is accountability in the way that resources are being utilized in the country. So the different ways of engaging the different segments of the society, depending on their capacities. Even when you're doing advocacy, like we've worked with the doctors' union, the nurses' union, being the ones who are directly involved with some of the inefficiencies that are involved or that come in terms of resourcing for service delivery. And they add their voices in one way or another in terms of the work that we do. So depending on the nature of engagement that we can have on a different segment of the society, they're definitely involved in championing for accountability, but also being the change makers or being the champions for integrity within their own spaces. Yeah, thank you.
Thank you, Titus. Thank you so much. We're actually a minute past time, so I just wanted to see if there was a little summarizing thought. Don't worry about the questions, from Helena and Charonda in terms of what's on your horizon in the coming weeks. Would you like to say a final word? Charonda?
Sure. First of all, again, Eloise, I'd like to thank you for inviting us all here to have this conversation, pulling us all together. To my colleagues who have spoken on the platform, I just want to say how inspired I am by each of you. The work that you're doing is critical, and I know that we all don't hear this enough. We probably hear more complaints than we do thank yous. So it's nice to know that I'm not the only crazy person in the world who has not moved on from COVID. To the members of the audience, I would just encourage you. I'm sure, from this conversation, it's probably sparked some ideas, it sparked some questions. I would encourage you really to think about your world. What is at your fingertips? What is your community? Who are the people that you can influence the most? And what is the change that would encourage you or propel you forward the most? That is the thing that you focus your energy and your drive on. And as far as the naysayers, don't worry about them. They're not important. What matters is the work that you're doing, champion your cause, and keep pushing forward. Thank you.
Thank you so much. Helena.
Yes, I think I would prefer to finish with Charanda's words because they were so inspiring. So we'd only say that it was a pleasure to be in the panel. And I think I've been very inspired. And for me, the next step now is like, let's all work together. Because I think what we didn't manage to do with scientists, we were managed to work together more, all the different like policymakers or healthcare workers. Now that we've got a bit more time and we can look into planning and thinking and strategizing, I think the next step is for all of us to work together and come up with strategies together. And we can all help each other, I think.
Thank you so much. And the good news is this is what Pandemic Action Network is for. We are really excited to work with community groups, the human stories, the human angles, to inject some life and lived experience, as you said, as our panelists said earlier, the lived experience, not just the top down, but the lived experience to get to where we need to get to. So a huge thank you from everyone at Pandemic Action Network, including all the partners on the call. Thank you for your time and attention. This has been really inspiring, and we will follow up with next steps and ways to work together because we are more powerful together. And thank you so much for telling your stories today. Have a wonderful day.
Bye-bye. Thank you.